Join Dr. Ameyo, Stella, Adadevoh, Draza Health Trust on Wazobia 99.5 FM Abuja every Thursday from 10 to 10:30 a.m. for the Draza Radio App Hour in celebration of Global Handwashing Day. They will be sharing stories and practical tips on how your hands can keep you healthy and prevent infections from spreading in your home and community.
Okay, now, una don't hear the message, and I hope so the message una hear as usual. Our lecturer don't come. Stand. Good morning, ma. You're welcome, ma. God, you know, say once give away day, that's why body they shackles. So, you know, say once you see person where they loyal, you know, now something they find and they tell you. So my sister Chinendu is here again every Thursday, and so she they join us. And not only say that they teach us how to wash our hands, how to avoid the germs, how to run away from them. She they also they give a giveaway because we like giveaway. Me, I love it. So we like them. So that one no come and say if you use this hand teach you something, go use this hand give you something. So Chinendu go first introduce who them be in case you just they join us today for the first time. Then once you introduce herself, then we will begin the ask and the question what we want to ask.
Abuja. Good morning, no.
Mom.
My name is Chinendu Koli. Now we be the tori officer, communications officer for Dr. Ameyo, Stella, Adadevoh Health Trust. For short, we are called Drasa Health Trust. And the organization, it was founded in honor of Dr. Ameyo, Stella, Adadevoh. If you remember that doctor for 2014, we had the first case of Ebola. And so to continue in her legacy, this organization started, and like as you did they listen to me, as you did for studio, our work now to develop the equip health champions, quote unquote, other Dr. Adadevohs, we go fit, they identify, they prevent the spread of infectious diseases.
Okay, now don't hear them. So in case you just join us for the first time, this one is the third time, right?
The third time.
The third time you say she don't join us inside studio, so she don't already talk the importance of hand washing and why did they spread the message of hand washing. So before we begin the answer waiting carry us come today. Was it yesterday or the day before yesterday? A lot of people call me. They tell me say, Willie, we don't receive our gift. Oh, hey, say the gift no be small thing, no. Oh, fuck, I see your own. I thought I go thief your own gift. He said the thing big. I don't know say the thing big like that. So it doesn't tell there inside.
Yes, inside.
Other things are not go mention, no mention, and since they like go collect their gift. So we get two people where we say they never come collect their own gift. Your name na Patience Eme, I think Eme or Eme. 2 weeks ago, they say you never come collect your own gift. Then the second person again na Chukuma Ferdinand. Chukuma Ferdinand, they say you never come collect your gift. Your place, if you not say your place far, and you know if you come collect them, I think I advise you make another person win. Because I don't see any reason why your place go far, you can't apply, then you go come they give us condition. Where we say we go take do your gift for you. You get some people when I like their way. If they're not figure to say Willie, dash them to another person. And they like people when they do like that. So if you don't say no free come, we go dash them another person so that they use and do Christmas. Please, please and please. Before them pack come out for Abuja, go another state to go they run the same program. So Chinendu, you're welcome to Wazobia FM.
Thank you very much.
I'll still announce the name before we come out for studio.
Okay.
So quickly, make we put eye for the one who will carry come today because she sent me message, come they tell me say, Willie, did they see what they happen for hospitals? So today we go focus on how whether a doctor or nurse or even you where they take care of person, how you need to be careful about yourself concerning their body. Because I know Sir Apollo don't do now. So you now you need to be careful to wash your hands. So she did that beg.
So good morning again. I know say last week we talked about hand washing as per times where you supposed to wash your hands. Normally. This time around we won't look at hand washing for when you don't do hospital. So whether in a private or public hospital, whether in a primary health center, any kind of health facility, we won't talk today about the times where you supposed to wash your hand. So then they call them moments of hand washing or moments for hand hygiene. And now World Health Organization now in bring them.
Wait, you call
them
moments
5 moments of hand hygiene. 5 moments of hand hygiene.
Okay.
So these moments now for health workers and caregivers, people wey take care of sick people, whether now for house or even day hospital with them, to they watch so they go fit keep patients safe and no allow me germs waka enter for whether na the patient or the health worker or even the caregiver wey dey the hospital with them.
Okay, so what if they try talk now? Be say, for example, me, when they take care of somebody, I need to also know how to wash my hands well to take care of person.
Of course.
Then the person where they take care of too, suppose also know about himself. Suppose they tell me too whether I don't wash my hands. What do you mean?
So the reason we're doing this actually is for patients to be able to tell or rather know when the person who is taking care of him or her to do hand hygiene.
Okay.
But ideally, everybody's supposed to wash hands, which we don't talk, last week.
Okay.
This time around, the focus now for hospital, and we focus on hand washing for health workers, people where they take care of sick people. Where they say them, but they do make the patients they safe, make they themselves also they safe, make them know they spread germs whether not to patients or to themselves or even around the hospital environment.
Now, even we whether they take care of, so we too need to shine our eyes.
Yes, now
make the person know come they do a shaggy.
Yeah.
Okay.
So these 5 moments of hand hygiene, I sure say when I go down the ask waiting a day about. So you see there anybody if he fall sick, if it be me, if it be you, and by the time you go to the hospital, you go see say maybe you go enter one place, they say go make them collect your blood.
Yeah.
Right? All these are some of the procedures that where they happen for hospital. So imagine say una come be like 5 where they wait make them collect your blood. The person collect the first one, collect the second one, collect no hand washing. Right? So it is very important. And just for knowledge sake, I go just go straight mention those 5 moments where we say WHO or World Health Organization don't mark say make people where they take care of sick people they wash their hands.
Okay, sorry. Before she mentioned the 5, remember say question and answer deal. Before you go tell me say hear what she talk. So make we continue the 5 moments for hand hygiene.
Yeah. So the first one now, before any doctor, nurse or medical person for that matter touch us or our sick loved ones, they must wash hand. So before they must wash hand. And so the whole idea about it, they say before touching a patient is that's like a superhero action somehow, because if you days they say work plenty, go just they move from patient to patient and just they collect blood or just they touch. So it is very important. Say before touching any patient, the health worker, the medical person, or even the person where they take care of the sick person, suppose wash hand. And some of those important moments where we say you go wash hand before, because people will just think say now only when they want draw blood. Sometimes and when they want check readings like all this blood pressure, pulse, oxygen. Sometimes when they want touch any medical equipment where they go take connect to the patient. So for example, like all this IV, all this drip, all this catheter like urine bag where they take help patients to pass urine, or even putting oxygen mask, or even doing oral X-ray. Then another time when we say, sorry, not be another moment, but within the before, is also things like maybe when you want to bath your patients, when you want to give them food, help them wear clothes, help them brush their teeth, or assist them to move around, or even simple things like maybe helping them to, wear glasses. All these things fall under number 1, where we say before you touch patients, before you get any contact with any patient.
Because the person go already they carried away. He go come forget to even maybe just bath the person finish or help and put all those things. He go don't forget begin the feed them. So now don't already here now. You whether they take care of or they take care of a sick person where make you also the day observant of all these things. Make the person they wash your hand before other things. So these are the things where we say you're supposed to wash your hand before you begin the touch. Now what is they talk?
Okay. Then the second moment, the second time where you need to wash your hand, now after you don't touch body fluids.
Okay.
So body fluids now, all these things where we say like blood, saliva, mucus, sweat, all those things where we say, they come out from our body, they even feel splash, maybe health workers don't collect blood or they collect blood, if you still splash and all of that. So it is very important to wash your hand anytime where you don't touch any of those body fluids, whether as health worker or person will be caregiver. Caregiver are people where they, take care of the sick people.
Yeah.
So you feel wonder as in why that one supposed day, but then the thing is say some of those people they use gloves. But you know that glove self no be 100% proof.
Yeah.
You feel wear glove if you do small exercise now, go wash your hand, you go see say or rather example, go wash your hand on that tap, and you go see say some part of those water don't enter the glove. So you can imagine what will happen to all the other body fluids like saliva, mucus and the like. So you know today 100% proof like that. Or say you take care of patient and then the patient come vomit and all of that. So that one too now body fluid. So if you happen to say the fluid go pass through those gloves, and those gloves they get tiny holes, and then if you expose, you know, the caregiver to germs. So now make we dey say make you wash your hand after you don't touch any of those body fluids, so that you go protect the caregiver where they care, or the health worker where they care for the sick person.
So we don't mention two. So we don't mention two. So remember what she talked before we start. It don't say you feel sick, I feel sick. Some people don't they say I reject it in Jesus. No be reject now. Just get the common sense now where she did through it now. So quickly before we go still ask our question, hope you don't jot waiting that they teach you now down. So move we continue.
The third one now, and another time where if you wash your hand now, after you don't touch the sick person. Remember the first one now before you touch sick person. Second one now after you don't touch, you know, body fluids, anything where you feel like urine and all of that. This one now after you don't touch the sick person.
Oh, they're different.
Yes, they're different.
First one now before you touch the person. Second one now when you touch any
body fluids.
Then the third one.
Now after I go explain why all these things there.
Because you confuse me now.
Before, after, day. So I go explain as you go. So this one today important, and it means say you must wash your hand after you don't touch patients or the sick family member and anything where they close to them. So for example, after you don't help the sick person go toilet, or you don't help them stand up, or after you don't deal with any medical procedure where they connect the patient, you know, to any of the things like maybe like these IV pumps or those machines where you don't talk, oxygen masks and the likes. So we need to do this one to protect the caregivers or the health workers and the environment from the germs where the person see gets. So make you remember, say when you wash your hand before you touch the sick person, you dey protect the sick person from the germs. But when you wash your hand after touching the patient, you dey protect the health workers and the caregivers or the patient relatives as well as the environment.
Okay, you don't say because that number 2 and 3 come they confuse me one kind. I mean, they think saying at the same thing.
No.
So how they take different?
So the first, is it 2? The 2 is the body fluid. After you don't touch body fluid. That one
the number 3 again is
number 1 after you don't touch the patient. So if you say you don't touch patient but you don't touch, you know, body fluid.
Oh, no, I don't understand.
If you say you don't touch, like all these maybe wearing of glasses or maybe, you know, touching them and all.
Okay.
So, but you still supposed to wash your hand. And like I don't talk, if you wash your hand before and I say I won't keep my hand clean, make germs no reach the patient.
Okay.
If you wash your hand after now, I don't finish all the procedure. I won't keep myself, maybe the caregiver, clean. And also the environment. Make it not be say, as I don't finish from the patient, my hand they clean. I told the patient I don't finish. I carry what the patient get, come put for my own body. Or
no, I don't understand. So the first one I say before you touch the person. Then the second one I say while you they touch the person, something will happen.
Yes, like vomit, blood,
Suppose wash your hand before you continue.
After you don't finish that procedure.
Then the third one I say once you know say don't finish
with the patient.
Oh, no, because that number 2 and 3 confuse me.
No wahala. Then the fourth one, the fourth moment, now before they won't do any kind of super clean or hygienic procedure. So one of those super clean procedures now, when they won't do operation, they call them surgery, but we they call them, you know, operation. So, and you know, say after they talk for Nigeria, we go say your face shine, I be your shoe show, your hand supposed shine. And why is it very important? They say for procedures maybe like operation, the people where they do them not supposed to touch anything. The patient or even this thing before the procedure, they're supposed to make sure say their hands they super clean, the environment. So before the operation starts, or anything for the environment, so the hands supposed to be very, very clean. And it's to protect the patient from, you know, harmful germs. Make sure say nothing enter the patient body. Not even the patient's own germs or even the germs of, you know, the person where they do the procedure. So that's why we say it's super clean or hygienic procedures. So apart from operation where we say na surgery, other procedures will fall under this particular fourth moment where we say na super clean. It has to be super clean. Is when you they handle like all this wound dressing. when you dey deal with all these urinary catheter, because some people they know they need all these bags where they go attach to help them urinate.
Yes.
So that na the one for the fourth moment.
Okay. Okay, more they go on. You said na 5, Abi?
Yeah, na 5.
Okay, more here the 15.
Okay, so the last one, which also dey important, and another important time where you must wash your hand now after touching anything around a patient or inside the place where the patient dey.
I don't understand.
So this one now, it dey different from whether you touch patients or you feel no touch patients. But you feel touch other things where dey the patient's room. Do you understand? You say I no touch patient too. Why I go still need to wash my hand? But the truth is say as a health worker, family member or visitor, you feel don't touch the bed, you feel don't touch the drip stand, you feel don't touch the table, you feel don't touch the patient's personal things. They feel even help you ask you to touch maybe things where the patient self don't touch, like go switch on the light or switch off the light.
Okay.
You know, all those things where dey the environment. So it's very important make we wash our hand for this time, because it dey also help protect us, protect health workers and the health environment from the risk where they, if germs don't contaminate all those places from. Because patients dey there, you don't know wetin they don't touch. But as long as you don't touch, you be like during COVID, they say when you touch surfaces and all, they too they don't touch all those surfaces. So if you dey their room, don't touch. You don't know. In fact, you don't go even feel no wetin they don't touch when you don't touch. So now why is it important? Say you suppose wash your hand after touching anything where they around or inside the place where the patient dey.
So you can say these are the 5 moments
of hand hygiene.
For hand hygiene.
Yes.
Okay, a lot of people go just they wonder why she they always break them down like this. They break them down so that you self go even know. So many people they carry away when they walk. You understand? Sometimes you don't go even know when you won't do this, or maybe you don't wash your hand finish. You call go back. Remember, say suppose off the socket. You know that kind of a thing. Before you know, all those mistakes will come. So quickly, make you begin to prepare the answer where you go give us before I open my phone line. So make my sister help me conclude so that I will just open the phone line now.
Okay. So we don't talk these 5 moments of hand hygiene. And I know say why we they talk Madam, will you come ask which one be this, which one be this?
Because I can't be confused now.
As we don't summarize them, I want to talk something. Say 2 of these moments where we say before touching the patient and before any super clean procedure like all this surgery, handling of wound. Now to make sure say patient wey fit be me and you, they safe.
What do you call them?
2 of the moments where we say to wash your hand before touching the patient, and before doing any super clean procedure like operation. Now to make sure say the patient they safe. Then 3,
Okay, go ahead.
Then the remaining 3 where we say now after touching the patient, after you don't dey exposed to body fluids, and after touching the patient environment. Now to ensure say caregivers like patient's relatives and health workers they safe while then they take care of the person. Of the sick person.
Okay, now I don't understand. So now the 5 moments for hand hygiene. You they tell us see what we supposed to do. So now this one where you just talk now. You they tell us why
we they do them.
We they do them.
Yeah.
Okay.
Yeah, because as we they have the conversation, it can't be like say they look alike, but they don't look alike. You know, you asked me that time whether you go wash before, you go still wash after. So I can't explain. So 2, the washing your hand before touching the patient, and also before any super clean procedure like operation or say you dress wound, now to protect the patient. Just think of, I won't wash my hand before I touch this patient. I don't want make anything enter the patient, right? Then those remaining 3, like after you don't touch the patient, you don't finish the procedure, or maybe after you don't expose yourself to body fluid, so you don't collect sample and some of them splash, or after you don't touch the environment, now to protect you. Will be the caregiver, or you will be the healthcare provider, or even the environment. So why we they talk about all these things now, make we remember, say it they all about making everybody day safe and healthy. So the next time when you see your health provider, quickly wash hand or do all this hand and sanitize the hand or do a hand rub. You go sabi say then they follow the important moments. And if you notice say they know they do if you remind them small and with respect, say this one now waiting you supposed to, because I don't learn them for this particular radio show. Okay. So now go use sweet mouth, because some of them you won't teach me my work. Oh, you can't do them now. I beg you. Oh, yeah, now remember say she teach us 5 moments of hand washing.
she teach us what you suppose do. Then after she can't teach us what we suppose do, she can't teach us why we suppose they do these 5 things. Why you they do them? Now what she teach us? So right now, I want to open my phone line so that she go ask us the question where we say she want ask us. Remember, Patience, Chukuma, Ferdinand, you never come collect your gift, and they call them so that if you don't come, we go give you deadline. If you don't bring the deadline, my village people that around go carry and give them. The number is 070-0995-0995 inside studio. Please, if you don't win before, you don't go win again. Make another person else enjoy. If you change your name, I know your voice. Let me wait here and go tell you. Hello?
Hello.
Yeah, hello. Good morning, ma.
Good morning, ma.
I greet you. What they talk to?
This is Blessing Sugamaji.
You said now who?
Blessing from Sugamaji.
Blessing.
From Sugamaji.
Okay, Blessing, not ready for your question?
Yes.
Oh, yeah, go ahead.
Blessing, we get 7 questions. You feel pick one number.
Okay.
Pick one number.
Number 1.
Okay, number 1. Okay. The question are 2 in 1. So how many moments there for hand hygiene? And you go call list 3 of them.
Okay. Number 1. Before you see the patient, you...
Hey!
Ah.
Hey! Village people. Anyway, your name is Blessing. You go finish them. Hello? No, fuck, we don't play before. You play before. Oh, Stella, thank you. Stella, thank you.
I want just thank them.
Okay.
Whose voice is that? Now, Brendan.
The one where we own.
Now, Brendan.
Receive my gift.
Okay. What is your name again? Your real name send.
Now, Brendan.
Okay.
I heard the voice.
Oh, yeah, now, thank you very much for that one.
All right.
Yeah. He called to say thank you. Hello?
Hello, Willie. Good morning.
Yeah, good morning to you, sir. Where they talk to, where they call us from?
I'm calling from Kageni. My name is Steven.
Okay, I got you. You don't ready? I pick your number.
Number 1.
No, they don't pick them now. You don't already. You don't already go Google them now. Pick another number.
Okay, number 2.
Number 2 question say list 5 examples of things where you fit see around sick person. I mentioned that when I did talk. 5 things where you fit see around sick person. Or if you don't go hospital before see sick person, waiting you fit there around sick person. Just mention them.
Okay. We have injection apparatus. Then we have drip fluid and a blood pipe. Then we have something like first aid and a box that they normally store their food if they want to give them food. And we have their bed.
4. You mean 1?
And we have a sanitizer there. Sanitizer.
Okay, you don't try. Make we clap for you.
Oh, God, the way they talk, man, you say, if I don't win this in there, you go swear for me.
Well done.
What will be your name?
Steven.
Steven waiting.
Steven Anaja.
Anaja. Okay, what will be your number?
Yes, ma'am.
Okay, now thank you very much for that one. So, at least your mind don't kulu temper, be.
Yes.
Yeah, now thank you. Congratulations to you. Nothing do you. Hello?
Hello.
Yeah, good morning to you. Where they talk to, where they call us from?
Morning. This is Lady C from Airport Road.
Lady
C.
Lady T, pick your number.
Number 4.
Number 4.
Number 4 question say list 2 activities where then they see as super clean or hygienic procedure for hospital.
Washing your hands before touching the patient. And after touching the patient.
No, they said super clean. Super
you know, I
clean.
mentioned one moment where we say you go wash your hand before doing that super clean and hygienic procedure. And I list examples. So list 2 examples of those procedures.
Okay, it's when you want to do surgery. And after the surgery.
No.
Spread the bacteria.
Try again.
No, you don't get them.
You only answered one. You remain one. When you want to do, before you do surgery.
And when you want to carry out surgery.
When you want to carry out surgery, now just one, now one of the answers. You remain another one.
No.
Okay, so you don't try. Make me clap for him.
You try. You never get that. They send at 2 and the only one you don't mention. Hello? Hello?
Hello, Auntie.
Yeah, good morning to you. Who are the talk to? Where they call us from?
My name is Grace. I call from Kubwa.
Grace! Pick your number. You know I shout your name.
Now number 5 to this 7 we get now.
Grace, pick your number.
Number 5.
How many of the moments, those 5 moments where I don't mention, how many of them they protect patients?
I mean, 1, by making sure the environment is clean.
You're supposed to list those moments. You know that I mentioned 5 moments. I can't separate them. I said this one they protect patients. This one they protect caregivers and health workers. How many of those ones they protect patients?
Okay. 1.
You know answer I'm correct too.
You need to wash your hands.
No, you get 5 moments. I can't separate them. So, but not be 1. Now, 2 of those moments they protect patients. The remaining 3 they protect patients. People where they take care of patients. So, thank you very much. If you try another time.
Hello?
No.
Yeah, what's your name? Where they call us from?
She's from Airport Road.
Okay, pick your number.
Number 5.
They just answered the pick numbers between 6 and 7.
Okay, give me number 6.
Number 6. I mentioned say 5 moments of hand hygiene day.
Yes.
How many of them they protect health workers?
Almost all of them.
You know that I'm correct too.
Number, is it caregivers or the patients?
The one where they protect caregivers.
Okay, is number 4. Before the operation.
Then day 5, I can't separate them. How many they protect caregivers? Out of those 5.
Okay, number 3.
Correct. Now 3 they protect caregivers.
Okay, now. Madam, what's your name again?
She's from Airport Road.
Your complete name? Choma waiting. Ezani. Okay, so what will be your number?
Yes, 57.
Okay, now thank you very much for that one.
Thank you, ma'am.
So for those of Nawe win and those of Nawe no win, Abemona no verse. Next time when she come again, we will try and make sure so una win. So my sister, beg help us just round up.
Thank you very much, everybody. We listen. We go see another time next week, the same 10 o'clock. If you want to follow the work where we do, you should see us for social media at Drasa Trust, at DRASATRUST.
And it be like say sometimes they feel they do give away for their handle. So now if you go there, they follow them. Patient you never pick your own. Chukuma Fedna, they never pick your own. Today winner, now Steve, Anaja, and Choma Ezane. Now get her, they go call una and give them a gift. Thank you very much, and God bless everybody.
Join Dr. Ameyo, Stella, Adadevoh, Draza Health Trust on Wazobia 99.5 FM Abuja every Thursday from 10 to 10:30 a.m. for the Draza Radio Half Hour in celebration of Global Handwashing Day. They will be sharing stories and practical tips on how your hands can keep you healthy and prevent infections from spreading in your home and community.
Welcome to Wazobia. Okay, somebody say...